It's Dr. Cole Messersmith from OBGYN Associates of Advantia at both our Silver Springs and Beltsville locations. I wanted to talk to you a little bit more about sterilization. Well, sterilization is a permanent form of birth control that's done through a procedure on men called a vasectomy, or a variety of other procedures that can be performed on women that I'll touch on in a moment. This is an irreversible form of birth control, so all women need to be reasonably sure that they don't see children in their future before having a sterilization procedure performed, because it's very unlikely that you can change a sterilization procedure after the fact. Sterilization procedure is highly effective. Less than 1% of women who have a sterilization procedure will have an unintended pregnancy after the procedure is performed, so it's really effective. Now, the way that a sterilization procedure is performed is essentially by blocking or removing a part or full fallopian tube, so that essentially this connection point or highway between the ovary and the uterus is removed. By removing or blocking this connection point, the egg and the sperm can no longer meet each other, and a fertilization event is avoided, and thus pregnancy is avoided. Now, the way that a sterilization procedure is performed on a woman can take a few different forms, and oftentimes depends on when it's being done. So the first that I'd like to highlight is something called a postpartum tubal ligation, or a tubal, that you may have heard of colloquially in the past. This is typically done on a labor and delivery operating room 1 or 2 days after someone's had their baby, and is done under something called neuraxial anesthesia, meaning a more epidural style anesthesia where you don't feel any of the procedure, but you're not fully asleep. Typically in this procedure, about a quarter-sized incision is made under the belly button, and both fallopian tubes are either blocked or removed through that one incision. Now, not every hospital logistically has the capability to perform a postpartum tubal ligation, and not every provider is going to be able to offer this. So I encourage you to talk to your providers to see if this is even an option for you. Now, unrelated to pregnancy, there's another series of procedures we can perform for sterilization that you can do at any point in your lifetime. These utilize a procedure called laparoscopy, which is a minimally invasive GYN surgical technique. In this way, you will go to an operating room, just like any other surgery would be done, and have a series of generally jelly bean-sized incisions across the abdomen, through which a camera and several helper arms are going to be placed to perform a surgery to remove a portion or entire fallopian tube. Typically, the entire fallopian tube is removed in this procedure, and in this procedure that's called a salpingectomy. The recovery time is very brief. Most women go home the same day from this procedure and are back to normal activity within a couple of weeks. But realistically, most women feel pretty much back to baseline within a few days. The side effects or risks are very minimal from this type of procedure since it is so minimally invasive, and it's very effective, like I said, with over 99% efficacy. Some other fun facts about having a sterilization procedure is that it's actually, over the decades, the most popular form of birth control that has existed, with hundreds of thousands of women having a sterilization procedure each year. It does not prevent any sexually transmitted infections, so it does not have any protective effect against STIs. It does not have any effect on your menstrual cycle or period. You still will have periods after having a sterilization procedure performed. And then another really exciting potential benefit from having a salpingectomy, meaning removal of the entire fallopian tube, is that there's promising research to show that this may actually decrease a woman's chance of having ovarian cancer in the future. So in addition to preventing pregnancy, maybe preventing cancer as well. So research is still ongoing, but a very promising added benefit from this procedure. I personally perform sterilization procedures, as do many of our other providers here at Advantia. So if you have any questions about sterilization procedures, want a sterilization procedure, or want to talk about birth control as a whole, schedule an appointment with me or any of our other providers here at Advantia.